Hi, I'm Dr. Marcus Hill. Thank you for taking the time to watch this informational video on full arch dental implant reconstruction and the All-on-X procedure. I'm excited to make your smile, and thank you for trusting me with your care. If you haven't already watched the All-on-X introductory video, please watch that one first. This video is designed to give you more information about the risks and benefits of All-on-X and help you prepare for the day of surgery. First, I'm sorry about your chronic dental issues. It can be really hard dealing with frequent dental problems and infections. Let's talk about how we can help you fix it. Whether you call it All-on-4 or All-on-X or teeth in a day or full arch implants, it's all the same procedure. Over 90% of people who have full arch implants keep them forever and never have another infection or day of missed work. And the best part of this life-changing procedure is it's all done in one day. And with the All-on-X procedure, we'll take away all the bad teeth and we modify the bone to fit the future implant bridge. We'll place at least 4 implants, and depending on how many fit, we may actually place more than that. But the 4 implants will be placed, and then a strong, solid platform will be made for your new smile. The implants will be angled to miss the important structures and still get as far back as possible to give you the equivalent to a full arch of teeth. Now, a dental implant is a titanium screw that goes in your jawbone. On top of the main screw, we will place a second part that comes from the level of the bone through the gums called a multi-unit abutment. This abutment will correct the angle from the angled implant to be straight so that your teeth can be screwed into the implants. With traditional dental implants, after placement, the implant will have to be left untouched for around 4 months to allow healing. During this time, the implant fuses to the bone to become strong enough to support chewing on it, or osseointegrates. With All-on-X, we will almost always give you a screwed-in smile the same day. This works because all of the implants be connected as one solid platform, and then the teeth are attached. However, even though we make it strong enough so you don't have to wear a denture, you still kind of have to eat soft foods for the first 3 months. And if you can squish the food with your fingers, you can have it. But if you have to use the tip of your finger to push through it or almost your nail, that's too hard and it risks making your implants fail. And they won't fail right away, it won't hurt. They'll just start to fail over time if you're eating too much. So if you don't think you can limit yourself to these type of foods, then you should plan on staging your procedure and wear a denture for 3 months. We'll take the teeth out, place the implants, you spend 3 months healing in a denture, then after those 3 months, we can convert the denture to a screwed-in dental bridge. Rarely, if there's not enough bone, we may have to stage your procedure like this unexpectedly. This is less than 5% of the cases, but for some reason, if the teeth don't come out well or an infection has removed the bone we need to properly anchor the implants, then you may be asked to wear a denture for 3 months. Again, this is not my plan, and if I'm worried about it, I will tell you before we start and make that very clear. However, it's better to spend 3 months in a denture now than it is risk your bridge failing or use the riskier, more dangerous backup implants that we want to save in reserve, like zygomatic implants. Bone grafting will be completed as well around the dental implants. This bone is harvested from around your teeth, or it can be synthetic bone or bottled bone that came from a cadaver, is sterilized, irradiated prior to use, making it safe. An anesthesia provider will put you fully asleep while we do the surgery. After we finish the surgery, we will wake you up for the conversion part of the denture. Nothing is hard about this, but it can take several hours with us working in a lab and then coming back with your new teeth, trying it in your mouth, going back and adjusting it in the lab, back and forth until it's ready to put in. Eventually, we'll then take it and actually screw it into your implants so you leave with a solid set of teeth. This can only be removed by your dentist with a special screwdriver. While asleep, we will also give you a long-acting numbing medicine that will last for several days to make you partially numb. This will help with your pain. The pain will slowly increase as the numbing medicine wears off, so you do want to take NSAIDs like ibuprofen if you're able to take it as soon as you get home. We'll also prescribe narcotics for you to take only if you need it. I recommend you take a half tab of the narcotic at a time. You can always take the other half an hour later if the pain is still intolerable. The pain gets worse over the first several days and then begins to slowly resolve. In addition to pain meds, we'll write for an antibiotic. Ideally, you would start this antibiotic at least a day before the surgery and continue it for a week after to help prevent an infection. We may also write for a prescription mouth rinse, and I'd like you to start this one at least a week before the surgery. To minimize pain and swelling, I recommend you ice your face for the day following the surgery and the day after that. This prevents the swelling. Try to also sleep with your head elevated to help the swelling go away faster. The swelling usually peaks 3 days after surgery. We may write for steroids to help with this as well. Placing dental implants can potentially damage the structures near the implant sites. There's a nerve that runs through your jaw and gives you feeling in your lip and chin. If this were damaged, you'd still be able to look normal, move your face, but you wouldn't be able to feel your lip and chin. This nerve is very close to where we place the implants in the lower jaw. So it is common for this nerve to be bruised during the surgery. This will make you temporarily numb. Your lip and chin will not feel normal for the first several weeks after lower jaw All-in-X surgery. It often feels tingly or partially numb in that time for several weeks before it comes back. And there's a 10% risk reported of it being some permanent, where one spot doesn't feel quite normal or it's still getting better every week. Now, personally, I've never had a patient where it did not come back over several months, so it's a low risk of a permanent nerve damage. There's also a nerve that goes to the tongue, but this is much less likely to be damaged and again is usually temporary. Your maxillary sinus cavity is located up above the upper teeth in the back. Your sinuses can easily be irritated from tiny allergens in the air and almost anything. So you can bet that with upper jaw surgery, your sinus cavity will be irritated. This is normal and expected because there's only an eggshell thick piece of bone between the top of the teeth and the sinus cavity. With All-in-X, we usually angle the implants to try and miss this cavity. And sometimes we'll place additional implants further back near the sinus to get a little bit stronger support for the back of the jawbone. There may be a hole between the implant sites and the sinus cavity, and if you blow your nose, you could blow bacteria from the sinus into the healing sites. Air passage can delay healing, cause an infection, or even possibly make the implants fail. So it's very important for the first 2 weeks after the surgery to try to avoid blowing your nose. If you have to sneeze, sneeze with your mouth open. It's the pressure we're trying to avoid. Now, the risk of serious sinus complications is very low, but short term you'll need to use saline rinses to spray into your nose, and you can gently inhale to clear them. Just avoid the pressure of blowing out. The most common complications are bleeding and infection. If you don't have any bleeding concerns and aren't on blood thinners, then bleeding is not a significant problem. But infection can be a legitimate risk. To minimize this, again, I'll write for a prescription strength mouth rinse and antibiotic, starting the antibiotic the day before surgery and continuing for the week after. In All-in-X, the implants are likely to succeed, even more likely than normal implants, at least a 95% chance of success. However, if we're doing this many implants all at once, it's not that uncommon for one of them to fail, especially if you don't follow the soft diet. When they do, it usually presents like a tooth infection or a mild pain. If you have new pain that starts several weeks after the procedure, make sure you come into your dentist's office to assess the prosthesis and take an x-ray. To minimize the risk of failure, make sure you follow all of the written post-op instructions, and again, especially following that soft diet. I will place sutures to help you heal faster. The sutures dissolve on their own. There's nothing you need to worry about with them. Don't pay them any attention. Bone graft material, or tiny splinters of bone, will commonly make their way out. This is normal. Don't be alarmed. The tiny piece can usually be flicked out without affecting anything else. To go to sleep on the day of surgery, there are 2 important things that you need to do. First, have nothing to eat or drink for 8 hours prior to the surgery. This includes water, nothing to eat or drink. You can take your normal prescribed medications with just a sip of water, but nothing else. Second, you'll need to have a driver take you home after the surgery. Please make sure you read through the consent form. That's the actual consent rather than this informational video. But if you want more information about me, you can go to hilloralsurgery.com for more information and to watch this video again. I look forward to helping you with your new smile. Don't be nervous. This is so much easier than you imagine it to be. Thank you for your time and trust, and have a great day.